My name is Chris Otis. I'm the Executive Director for the Children's Relief Nursery in North Portland. And I just want to say first and foremost, thank you, Representative Blumenauer, for your vote recently to reauthorize SCHIP. We very much appreciate your support for all the children and families in Oregon, but certainly we appreciate what you're doing now and what that has done for children and families out here at the Relief Nursery. We are a child abuse prevention program working in North Portland with very young children, kids under 5, and their families, kids and families who are living in some very desperate, often very, very difficult and challenging situations. Families come to us because they need a variety of supports. And these are families who are living often in poverty, very much worried about housing, certainly worried about where they're going to get their next meal. And they come to us so that we can help them deal with some of those issues, but really help them develop a more solid and a supportive family life for them and their kids. One of the things that we do out of this facility, and we work with over the course of the year probably 250 children, and that would represent about 150 families. One of the things that we do is try to connect them to other resources in our community. That may be a social service agency so they can access some other services. It might be to an educational resource, or it might be simply to talk with a health provider. A lot of our families come here and they are lacking lots of things, but certainly health care and medical coverage is one of them. So by your vote, you've simply made our job easier, but more importantly, you've made life better for the kids and the families who come to the Relief Nursery. So we appreciate that support, clearly appreciate everything that you're doing for kids and families in Oregon. Thank you.
Hello, Congressman Blumenauer. My name is Sue Sumter, and I'm the Patient Services Manager of the Leukemia and Lymphoma Society, serving children diagnosed with blood cancers. I want to thank you so very much for reauthorizing the 2009 SCHIP bill. This is going to make a huge difference in the lives of our families who are fighting cancer for their child. This means that more children can be insured, and it's one less worry for the parents about how they're going to pay for their child's treatment. Every 3 days, a child in Oregon is diagnosed with cancer, which has a devastating impact on the families. And now there's one less thing to worry about because these children will have health insurance. Children diagnosed with blood cancers have 2 to 3 years of treatment, and so this is not just a question of health insurance coverage while the child is in treatment for their cancer, but really also for the rest of their life, because they have to have ongoing medical checkups for the long-term complications that can occur because of chemotherapy and radiation. So on behalf of the children in Oregon who have cancer, and my son is one of them, so on behalf of all of those children, thank you so very much for reauthorizing this bill.
Congressman Blumenauer, thank you very much for your recent vote to reauthorize SCHIP. My name is Linda Nilsson Solaris, and I'm the Executive Director of Project Access Now. Project Access Now is a nonprofit organization in the Portland-Vancouver metropolitan area that connects low-income uninsured patients with volunteer health care. We work with about 2,100 physicians and all the hospital systems in the area, and safety net clinics, and all sorts of people that are committed to providing care to the vulnerable in our community. And what Project Access Now does is to organize that care, to recognize that care, and to do our best to create relationships that bring transparency and equitability to charity care in our community. We're very grateful for the work you've done on a national level. We're looking forward to some great healthcare policy to come out from Washington, D.C. in the very near future, and we will do our best to work with you to implement that so that we all have access to health care. Thank you again for your advocacy and for your vote on reauthorization of SCHIP.